Okay, thank you, Kyle. So if I can invite the panelists to come up to the table. So as they're making their way up to the panel, what we're trying to do in this panel is really talk about the journey, and as I said, either the journey to shared value or the journey to something else. And I'm going to ask the panelists, so pay attention to me. I'm going to ask.
Sit down and listen at the same time.
I know you can walk and listen. So I'm going to ask the panelists to resist the temptation to go into detail or even talk about their specific initiatives, and instead focus on why did you make the decision to go in that particular direction? How did you get there? What challenges did you face? So it's more, we really want this panel to be more about the how rather than the what. So that's where we're going to focus. And what I'm going to do is I'm going to pose a series of questions to them. And then if we have time, not sure that we will, but if we have time, we'll open it up to the floor. Okay. So they're very... You could kill yourself on these chairs. Okay, so since I'm sure everybody's tired of my voice, I know I am. I am going to ask each of the panelists to do a very, very short introduction of themselves, and then we'll get going with the actual topic of the panel. So, Kate, do you want to start?
Sure.
Thank you, Brenda. So, hello, good afternoon, everyone. My name's Cate O'Kane, and I'm the Director of Corporate Partnerships and Philanthropy at PSI. And having looked at the list of the other panelists, I'm going to imagine some of you don't know who PSI is, as opposed to Pepsi and Aetna and other things. We are an international NGO based here in DC, but with programs in 65 countries around the world. And our mission is essentially to make it easier for women and their families to get access to health products and services. We started in family planning many years ago, but now we are across as many different areas as there are problems. And a little bit about our journey with shared value is that really it's something that we've added to our arsenal of different ways in which we can ensure that we're going to be able to achieve that mission, to make sure that people can get the access to their health products and services. We're an NGO that has always been very focused on the private sector and the efficiencies in the private sector. The fact that Kyle worked for us for a good 15 years, 10 years, and is now doing the job that he's doing, I think shows that it's always been something that's been at the heart of what PSI has been about. And as we've gone on this journey, we've been working with people who are thinking about philanthropy, we've been working with people who are thinking about CSR, we're working with people who are really coming to us and saying, we want to look at the 65 countries you're in and see that as market access for our products. How do we do this together? And so on this journey that we're on at the moment, it's still discovery. Kyle again showed a picture of the CEO, the marketing person. Essentially, we don't know quite where this journey's going, but we're excited to be on it. And we see it as the momentum to ensure that we're no longer just looking at one-year grants with our partners, but really long-term business investments that they and we can create for markets that are going to work for the poor.
Good afternoon. I'm Nancy Mann. Someone was speaking earlier about hybrids. I am a hybrid. Half of my job, I'm the SVP of the Estée Lauder companies for global philanthropy and corporate citizenship, incorporating two of the terms we've been talking about today. And in that role over the last year, I've been looking at our family of brands and trying to globalize our approach to good works, which we'll talk a little bit about. I also, the other half of my life, I am the executive director of the MAC AIDS Fund, which is the philanthropic foundation of MAC Cosmetics. We raise about $50 million a year through the sale of lipstick, believe it or not, to give to AIDS. And over the last year in particular, we have about 600 grantees in about 92 countries. Over the last year or so, as the technology and the treatment of HIV and prevention has really increased really in sole part due to the pharmaceutical industry. We've been looking much more concretely at having private-public partnerships around ending AIDS in certain cities, both within the United States and globally. And then lastly, I'm also the head of the Obama Council on HIV and AIDS.
Hi, good afternoon. Obviously, I'm sure everybody in this room knows PepsiCo. But very few people actually understand the company. You understand or often know one of our brands. If I was to tell you that Pepsi is 15% of our business, and carbonated soft drinks are 25% of PepsiCo's business. The other 75%, most of you would not realize when you're consuming a Pepsi product, whether it's Quaker Foods, Tropicana, Gatorade, Lay's, or if you go to Russia, we're Russia's biggest baby food company. We are Russia's biggest dairy company. Or you buy Sabra hummus, you're buying a Pepsi product, or a Frappuccino from Starbucks, you're buying a Pepsi product. So my point is, I have this interesting portfolio of businesses that really gives a whiteboard to think about sustainability in a very different way. The scale of a lot of what we've talked about is something else that makes my job interesting, challenging, fascinating. About 1.3 billion people will consume one of my products every day. There are very few businesses, if anything, that I can think of that has that sort of reach and scale. We operate in every country on the planet except for 2. And so we truly have the geographical footprint. And we'll talk about it a little bit later as we come into it, because it really touches at the heart of what we're talking about, that is sustainability on the planet and sustainability of humanity as a population. We started Performance with Purpose and a Sustainability Journey not when the article that we've been quoting was written in 2011. We actually stated this in 2006. 4 to 5 years prior to this article coming out, Indra Nooyi framed that we were going to be about performance and we were going to be about purpose, and it wasn't going to be about what we do with our money, but it was going to be about how we make our money. So I'd like to think in many ways we were one of the pioneers, and if the time journey you just showed, we are really at the right-hand side of that spectrum, and we can get into our learnings and where we're going. And I think it's exemplified by my role. I'm the vice chairman of PepsiCo, and I don't have responsibility for the philanthropy versus the operating business. I'm vice chairman of PepsiCo. I have responsibility for the entire business's portfolio, all of R&D, safety, regulatory, et cetera, all business unit innovation and pipeline report up to me, but at the same time, I also chair our sustainability agenda for the corporation. And through that, that means agriculture, water, energy, carbon, human sustainability, et cetera. And I think we're one of the few companies that truly have now evolved to bridging this into the operating senior executives as opposed to looking at them separately. A lot of learnings along the way, but let me just set the stage there, because as we look back at a decade of doing this, I think absolutely it is the way to do business to grow our business. And I think that's something that the afternoon I've been listening to, perhaps I haven't heard enough of. We've heard a lot about the trade-offs. We haven't heard a lot about, well, what is the growth opportunity for a business? It isn't any longer about the right thing to do. It's actually the only way to operate in order to sustain growth. So for us, sustainability is confused with a social agenda. We're talking about sustainable business growth. Let me hand over.
I think I picked the wrong seat. Tough act to follow. I don't purport to touch 1.3 billion people a day, but I do have a hand in many hundreds of thousands, I suppose. But so I'm Lori Stetz. I'm the Senior Medical Director for Aetna International. I don't work directly for the Aetna Foundation, but we do have a robust foundation that's been in existence for, I guess, 40-something years. I think it was said earlier today that every company in the world is in the healthcare business, and I think we certainly are. In fact, our mantra really is building a healthier world. So, that is our singular focus, whether it's in the U.S. or internationally. So, I struggled to try to identify where we are on the journey to shared value, because when I really looked at the elements, I think, they're all there. We're doing things that are doing good and are feeding back into the business in many different facets through the foundation, but also through some of the clinical decision-making that I do, if you want to look at a very micro view of it. But, from the foundation's perspective, we're looking to, to fund technology, to advance innovation, to increase access to healthy food and opportunities for physical activity in underserved communities, and really to bridge the gap that exists in health equality. All of those things, one could say, would feed back into the health of the people we insure. So in a very blunt way, that serves our business. That probably reduces healthcare costs and serves our business. But obviously, it's much more than that. You know, we look to impact on specific disease outcomes with some of our programs. We look at best practice identification and innovative ideas that translate into new products and services. So all of that really kind of comes together. If you say the phrase shared value to the folks at the foundation, they're not, you know, it may not resonate in quite that way, but I think the elements are really there. I think I'll pass it along.
Hi, I'm Bart Peterson. I am responsible for corporate affairs and communications globally for Eli Lilly and Company, and that comprises all of our government affairs and public policy work, communications, of course, market access in every country except the United States, and also our global health and our corporate responsibility work, including our foundation. And while we'll talk a lot about, further, I should say, about our journey towards shared value, I'll just sort of summarize it briefly by saying, when I joined the company 6.5 years ago, we had one global health program, and it was called the Lilly MDR-TB Partnership, Multi-Drug Resistant Tuberculosis Partnership. Really an extraordinary partnership, an extraordinary story, but I'm not going to talk about it today because it's not a shared value initiative. We are a non-communicable diseases company, and there was a historical reason why we have invested to date over $170 million in fighting drug-resistant tuberculosis when we are no longer in that business. But I'll leave that story for another day. We looked at, when we became familiar with the concept of shared value, it made a tremendous amount of sense to us, in part because very few people in our company were involved in the multi-drug resistant tuberculosis partnership. We had partners all over the world, but almost nobody in Lilly was involved with it. So we created the Lilly Non-Communicable Diseases Partnership, which primarily focuses on diabetes, and saw that as the harbinger of a complete shift into the arena of shared value. I would say we have evolved over the last 5 years or so to realize that there is a place for shared value work in our company, an increasing role for shared value, but not all of our corporate responsibility work and sort of looking at this as the reason for being for our company does not exclude traditional philanthropy and does not exclude continuing our work in fighting multi-drug resistant tuberculosis. So it's become much more complex for us over the 5 years that we've been involved in shared value, but I think it's becoming a deeper and deeper part of our company as well.